about reproductive sort of options, sort of anything else that you have, feel free to ask. And then we'll be moderating the online chat too. So if anybody's online and has questions, feel free to type them in and somebody will read them out.
I'll just say, I mean, we want this to be like the last session, very informal. You know, don't be shy. There are no stupid questions. Genetics gets very complicated. So any questions that you guys have, we're happy to talk
about. So, like gene therapy has advanced through the years. And if you have, so like my daughter is an anomaly with PTEN, and there's no other family members that we know of that have it. So is there any research where they like insert the missing link successfully? Like, are they looking at that kind of thing? I thought I had heard, and I can't recollect what disease it was that they successfully did that. I want to say that they brought the child up here to, I want to say Cooper, and there was a successful, but it was like first line of bifida or something like that. So is there any look at that for PTEN? I've been told that it's not that far up the food chain, and it doesn't have any hopes for it.
It's an excellent question. So for PTEN, I have not heard about anything with gene therapy. There are at least one or two conditions that they've been working on and have had some successful cases. It's a challenging thing when you're talking about fixing a gene in every single cell of the body to do that. So often the conditions that you'll hear about may be things like eye diseases, where if you can just fix it, you know, in the eye, it can help, or, you know, a specific system of the body that you can focus on. But PTEN, as you all know, can have effects throughout the whole body. So it's a more challenging condition to do that with. There may be people working on it, but I haven't heard anything specific for PTEN. But very possible something that could, you know, come through research in the future. Sarah, I don't know if you have anything to add.
The next speaker question we have is from Robin Moore. You have your hand raised. You can unmute yourself and ask your question.
When it comes to genetic testing, I'm just looking at my.
Robin, are you able to unmute yourself?
Are you able to hear me now?
All right, we're unable to hear you, so maybe you can send your message in the chat. We do have a message in the chat. What can my daughter expect for her possible children? Is Crispr an option for her future children? She is 6.
I can start, and then you can jump in, Kristen. So I'm sure, as most of you know, if you have PTEN and conceive naturally, your chances to have a child with PTEN is a 50-50 chance. If you explore some reproductive technologies that are available, that risk can be lowered from 50%. CRISPR is not something that I am aware of being used in terms of reproductive technologies at the moment. That's not to be said it won't be in the future. But right now, the things that we're talking about with our families is using IVF or in vitro fertilization. So creating a pregnancy outside of the woman, and then, you know, being able to selectively choose against PTEN. So that's the big one in the reproductive field right now. CRISPR, again, as far as I know, is really just on the research side right now.
Yeah, and just for those who may not be familiar with the term CRISPR, it's kind of connected to the gene therapy question. It's a type of technology that can be used to correct mutations in a gene, or sometimes for research they may want to, not in healthy people, but may want to like insert mutations into a gene. So that's what CRISPR is. Yes.
Okay, I was able to get Robin's chat. Her mother, sister, aunt, and daughter all have the pathogenic mutation R233. Why does this happen? We all have the mutation, by the way.
Yeah. So I guess hopefully I'm understanding the question correctly, or please follow up if I don't answer it. So it's generally, if there are multiple people in the family who have the mutation, it's going to be all family members will have that same change in the gene. And that's because that change is being inherited through the family. So, if a mother and a child both have PTEN, they're going to have the exact same gene change in PTEN. In terms of how that happens initially, and some of you I think are probably, you had mentioned, your daughter being the first one in the family to have it. That mutation can happen just, in one person initially. So the parents don't have PTEN, but they can have one child where just something happens in one sperm cell or one egg cell, or shortly after that sperm and egg come together, there can be a mistake that happens in the PTEN gene. That mutation happens without being inherited from mom or dad. So that's how it can start initially, but then someone, that mutation can be passed on from there. So I hope that answers that question. If not, please feel free to follow up in the chat.
Hi, thank you for your time. Should I be concerned with the exact strand from the initial genetic testing? I know that I was told that I have Caldens. My daughter has Banyan-Rule-Calva. I don't even know what my other son has, and everybody else is negative. But a lot of people come up with, I'm not to quote Facebook, but a lot of people post very specific issues, and then they say, and this is my strand, and I feel bad that I don't know my strand, and I don't. Is that important, or do we just treat symptomatically whatever's going on?
I think that's a great question. Right now, and I think there were kind of two pieces in there. So we kind of now refer to all of having anyone who has a mutation in PTEN as having PTEN hamartoma tumor syndrome. So it really is kind of a umbrella diagnosis now, where all of those other conditions all fall under that umbrella. So we think that everyone in your family has PTEN syndrome, whereas it used to be Cowden syndrome or BRRS. That's all really now just PTEN. In terms of, is it important to know your specific mutation? I think that's a huge area of research in genetics right now, and was kind of alluded to in some of the earlier talks of that genotype-phenotype correlation. Right now, we are not treating anyone differently based on the type of mutation you have. If you have a mutation in PTEN, we have kind of the same screening recommendations for everyone. That's not to be said in the future that might not change. And there's definitely active research in that area.
And I would just say, I don't think you need to be able to spout off, to anyone on Facebook or in the chat, what your specific mutation is. And that's also your personal information, for you to share or not share as you wish. But I think it's just good to be able to have access to a copy of your genetic report, so that if it becomes important, to know what your specific mutation is, so you have access to it.
For those virtually, we're fixing the screen.
Okay, I wasn't sure. So let me preface this with, because I don't know if the research exists to answer this question, but we'll find out. So there are at least 3 of us in my family with the same mutation. And I'm wondering is there any data that backs up? So for example, should I be looking at my mother's medical history for myself? And then my children for me kind of thing? Or is it anything goes? Like a simple example, there's no kidney cancer in my family. Obviously, I would not do the screenings, but should I be more focused on what's already there? Does that make sense? Okay.
Yeah, another really good question. So I think sometimes it can be important. Generally, it is the same screening guidelines for everybody with a PTEN mutation. But if there's someone in your family diagnosed particularly young with a certain type of cancer, like breast cancer or colon cancer, your screening for that type of cancer may need to begin earlier than someone else with PTEN syndrome who doesn't have that cancer in their family or has it, but someone was diagnosed, at a bit of an older age with it. So family history can be important, and sometimes we can modify the screening recommendations a little bit based on family history.
So what I'm hearing is don't not screen, but pay more attention to what's already there, kind of thing.
Yeah, and some people may need to screen more or screen earlier based on their family history. Exactly.
And I was just going to add, PTEN is a really interesting condition where people with the same mutation in the same family can present really, really differently. So we certainly don't change our screening recommendations away from what's recommended unless it's to screen earlier, or if there's something really rare in the family, we might look out for that. But great question.
Okay, we have a chat question. My son has PTEN. My paternal grand and father have symptoms of PTEN, although both have passed. I do not have the mutation, neither does my husband. Do we have any information about genetic mosaicism as causes of PTEN in cases like my family?
So that's a great question. I think the first thing to mention is PTEN is not something that skips generations. So if you have tested negative for PTEN, it's unlikely that your father had PTEN. Mosaicism is a kind of separate piece. So mosaicism is when you have the PTEN change in some of the cells of your body, but not all. Mosaicism can be a really hard thing to work up because while you might be able to take a blood sample, take a saliva sample, sometimes a skin biopsy, you can't really say biopsy the brain or things like that. So it's not a perfect system where we can tell you every cell, like which cells of your body have PTEN. It's more by looking at what tissues are quote unquote like affected tissues. The inheritance of mosaicism, I hope I'm making sense here, but if you have mosaic PTEN, it was something that happened after conception, so after the sperm met with the egg cell. So I wouldn't expect your parents to have had PTEN if you yourself are mosaic. And then depending on what cells are have PTEN in your body, you may or may not pass that on to future children. Hopefully that made sense.
Thank you. So my son has PTEN, but both me and his dad don't have it. So my question is, I know the chances for having another baby and having PTEN is very low, but how far along in the pregnancy can we know if the baby has it or not?
Yeah. So there are a couple of different ways that genetic testing can be done during a pregnancy. And this is something, as with all the things that we talk about, are, advancements continue to be made. But the main ways to test during a pregnancy are something called chorionic villi sampling, or CVS for short. And that is done usually at about 10 to 13 weeks of pregnancy. And then another option to test during pregnancy is amniocentesis. And that is done a little bit later, usually around 16 to maybe 14 to 18 weeks. Am I about right there, Sarah? It's been a while since my prenatal genetics classes. But yeah, so done a little bit later in pregnancy. And both can give you the same information. It's just a trade-off between CVS is done a little bit earlier. can be both of them carry some minimal risk that, there could be a miscarriage or complication to the pregnancy. CVS, I think that's a tiny bit higher than amniocentesis, but you get the information a little bit earlier with CVS than with amniocentesis.
I was just going to add, a lot of people now are talking about like what genetic testing can be done through blood work. On mom's end, there's no blood work that can be done right now to test for PTEN during a pregnancy. It has to be a CVS or an amniocentesis.
That's something that may be coming down the line, though. I think that's something where, the people who do that work on, testing doing genetic testing for the baby via blood sample from mom are always trying to expand what they can test for that way. So that's something that I agree is not available now, but may become available in the future.
And there's no other way of knowing a future baby will have it.
So I'll just repeat real quick because the microphone moved. The question was, there's no other way of knowing if a baby would have PTEN. Not to know, there's no other way to know during the pregnancy. Some people will choose to, just have a baby tested after they're born as well. So that would be another way to know, but just waiting until after the baby's born.
Or doing IVF with PGD, so testing an embryo before implanting it.
Are you guys aware of anywhere in Philly that offers gene testing for PTEN for someone just maybe at a lower cost than normal?
Yeah, so at our center, we always try to go through insurance for genetic testing first. And the way it works at CHOP specifically is if we get an insurance approval, we then get an estimated out-of-pocket cost for the family so that you kind of know what your costs are going into the testing. If we get an insurance denial or a high out-of-pocket cost, we do work with labs who have self-pay options for families that are usually much lower than if quoted at a high out-of-pocket cost. So we're happy to work with you because we do have options for families. We just always, as said earlier, just always recommend doing genetic testing with a genetic counselor to make sure you get that counseling up front and then afterwards with the results as well.
And I'll say it's not so important for the testing to be done in Philadelphia or in a particular place. If you're seen at CHOP or you're seen somewhere else, we always have the ability to send a sample out to a lab in another place. If there's a lab in California that offers a lower cost test, you can still, be seen in Philadelphia or wherever you live, and the sample can be sent to the lab.
Sometimes little kids are always very excited to hear their spit sample or blood samples getting on a plane. So.
Hi, I apologize if I missed this, but when I did IVF, it was well before I was diagnosed with PTEN. And having gone through trouble with fertility in clinic and all that, they offered the amino, testing, which I didn't want anything to bother anybody down there.
Yeah.
But they also didn't talk about PTEN. They talked about BRCA because I'm Ashkenazic heritage. So is PTEN in their vocabulary now when you come to clinics like IVF with people who are having trouble, like they know about it? Because they never offered that as even a consideration.
That's a great point. So we're talking about if you know that you have PTEN, doing PGD, which is testing an embryo specifically for PTEN. PTEN is not something that's tested on like normal infertility testing or testing during a pregnancy. That's more like chromosome testing for Down syndrome or other chromosomal conditions. So PTEN is not one of the like routine tests.
But in advocacy, which is why we're here, shouldn't it be?
I think it comes down to population risks and costs. So that I know we're in a room full of people who have PTEN or love someone who has PTEN or have a child with PTEN, but the incidence of PTEN is much lower than say like Down syndrome or other things in pregnancy. So unfortunately, we're not at a point right now in pregnancy that we can test for everything, because if we say, well, what about PTEN? There's another rare tumor or, rare genetic condition group that would say, well, what about this condition? So I don't disagree with you. I just think that the logistics are not quite there yet. I don't know if you have anything to add, Kristen.
I would say, I don't know, and you don't have to answer this, but, I don't know how long ago it was that you were, going through that process.
2011 and 2013.
Yeah. I mean, so I think we've learned a lot in the last 10 years, and people, obviously we have a long way to go, but I think people are more aware of PTEN now than they were then. So, it might be different today. I do agree. Generally, for the rarer conditions, it has to be, for them to, test for it in IVF, it has to be something that you already know that you have, or that there's a history of in your family. But it's a good point, and I definitely hear this from families with other conditions too, that they went through IVF or they went through prenatal testing, and why wasn't this tested for? And we, unfortunately just don't have that ability to test for everything. I think that'll continue to get better over time. I'm sorry for you that it's something that, that they weren't able to do at the time that you underwent that.
We do have an online question. Can an egg or a sperm be tested for PTEN before fertilization?
Good question. Yeah. So it's not something that I think is done very often. It is possible to do genetic testing on sperm, not so much something that is done on eggs. So I think that's something that probably depends on the specific family situation of whether doing the testing on sperm is something that would be helpful instead of, the IVF process or CBS or amniocentesis. But just in terms of what's possible, I know that the sperm can be tested. As far as I know, it's much more difficult, obviously, to get eggs to test. And then once you test an egg, obviously it can't be, used to conceive a pregnancy.
I'm just going to give the caveat that we both work in pediatrics, and the technology of genetics is constantly changing. So we might not have the most up-to-date information in the prenatal realm, but if there's a question we can't answer, we're happy to consult our colleagues in prenatal and get that answer for you. But we both work in peds.
Yeah, I will say too, it's generally when this question has come up for me, it's been around a parent who is mosaic for PTEN, or I've had this question for other conditions. So, they may not have that mutation in their blood, and we don't know. We generally tell someone if they're mosaic, the chance for your children to inherit, I'll stick with PTEN here because it's other conditions might be inherited in different ways, but we'd say up to a 50% chance. It may be less for you because we don't know, is that mutation in your sperm or your eggs, or maybe it's not in your sperm or your eggs at all. So that's where I have usually heard that question come up, just to give that information for everybody about testing eggs or sperm.
And we have one last online question. Are there any links between fetal hydrops and de novo PTEN?
I have not heard of a link. I think I see Sarah shaking her head no, that she hasn't either. But it's something we can certainly, I think we learn a lot, from our patients over time. There are things that we, didn't know maybe 10 or so years ago were associated with PTEN that we're starting to find out are. So I can't say it's just not an association that I've heard of.
So if the parent passing on the PTEN mutation is a mosaic, does that mean that the children that inherit it are also mosaic, or no?
Great question. So we would not expect that to be the case. So if you are mosaic, you only have the cells, as we've said, in parts of the cells of your body. But if you have it in that egg cell or sperm cell that's getting passed down to your children, that would mean that they're going to have it in every cell in their body, because that's just going to start with that one egg cell and everything would divide from that egg cell or that one sperm cell. So just because you're mosaic, if you pass it down, we would expect your children to actually not be mosaic.
Okay, it looks like we have time for one last question. Just give me a moment.
So in the meantime, you guys have had really fantastic questions, and thank you so much. So a quick follow-up to that last part. Is that, in theory, how some of us have a PTEN mutation, but like our parents don't? Exactly, yeah. So if you're mosaic for PTEN, that's going to be, something that happened after you were conceived. So that, so your parents would not have it. It doesn't necessarily mean that if you have PTEN and your parents don't have PTEN that you're mosaic. But anyone who is mosaic, pretty much by definition, their parents are not going to have PTEN. Okay. I feel like maybe, will it help if I maybe reword that? No, I thought you just led me to some other questions, but I'll figure it out later. I thought I understood something and now I'm good. We're happy
also
to
happy-
talk to you after too. Please feel free to come up to us if there were, and this goes for everyone, if there were any questions that you maybe didn't want to ask in front of the whole group, we're happy to talk.
Okay, we are going to move on to our next session, but you're welcome to leave any additional questions in the chat and we will forward them along. Thank you.
Excuse me? Absolutely. Is it a little bit? If it's the one, you want to just step outside, you can just answer it. Is Suzanne available?
I'm not sure if you can hear me, but do you want me just to share my screen so I can move the slides instead of having you do it?
Absolutely. I'm sorry. I
Okay.
apologize. I was reading to the group your bio and I did
Oh.
I did not unmute. But
Sorry-
absolutely.
sorry about
if you
that.
want to share your screen, I was just introducing you, Dr. Stanish. So welcome. We're happy to have you this afternoon. So I do have presented Dr. Stanish's bio. So if you're ready to present, you can share your screen. We'd be happy to listen in.
All right. Well, sorry to interrupt. I thought everyone was just on
I
break.
apologize.
So
I was unmuted.
oh, okay. Set me up.
Thank you.
Set me up there. No problem. Well, and can you guys hear me okay?
Yes, we can hear you well.
Perfect. Thank you. Well, I appreciate everyone's time today. I know I'm towards the end of the session and had a lot of great talks, but I'm glad to be in the group and I appreciate the invite from everyone there in Philly. I wish I could be there in person. As I interrupted, my name is Pete Stanich. I'm a gastroenterologist here at Ohio State, and I focus on taking care of people with hereditary cancer syndromes. And as part of that, I have a special focus in taking care of people with PTEN hamartoma tumor syndrome. I tend to use Cowden syndrome, so I may slip up and use that just because it's faster. But so